Hey, today I would be talking about my research, which is focused on empowering student health in a post COVID world. But before I get started, let me give a brief introduction about myself. I'm Luke, current sophomore majoring in biomedical engineering with minors in biological sciences at Stevens Institute of Technology, Hoboken, New Jersey. So let's get started with the topic. So now for a brief background and a brief overview. Why does student health matter? Stress would always impact learning. In case of college students or even high schoolers, the more stressed that individual is, it's more likely that they would be failing their classes or not be performing well in school or college. There has been a lot of research on this, documenting this particular phenomenon. Also, on top of that, college can be challenging. There was very many different types of stress factors that gets into a college environment, and it's very hard reversing all of them. As a result, mental health and other types of health as well, like just physical health, they might get compromised, and therefore it's very important that the student gets access to proper health care, and therefore health disparities should not exist regardless of the race, gender, or economic status of the student. So now, what was the research objectives of ours? Firstly, it was to collect data on student healthcare, uh, basically accessing the affordability and awareness, highlighting the disparities in this case. The next one was exploring the structural and personal barriers that might be preventing students from accessing proper healthcare. This might include lack of resources or systematic inequalities. The next is investigating the potential for community members and organizations to develop and implement a healthcare intervention system tailored to individual needs of the student, which basically means like counseling as well as stuff like mental health care, therapy, stuff like that, or just general engagements to promote health on campuses. So now, what was the research methodology of ours? The research was divided into two phases. One was the quantitative phase, and the next was the qualitative phase. But before I get into that, I would just give a brief disclaimer. This research is still ongoing. We have not fully uh, collected all of the required data points. So we would be talking, I would be talking based on the research data points we already have. So for the first phase, which was the quantitative phase, it was a mixed method survey, which basically means that we went up to random Discord servers like college Discord servers like Nitro or like College Search, something like that. And we basically requested students there to just participate in a brief survey. And our goal was get get the data points from around 2000 college students, and the data was basically on healthcare access, affordability, disparities, mental health, how you feel after the COVID-19 pandemic, how you're adjusting to college life after the pandemic. And we use descriptive and inferential statistical analysis to analyze this data. The next was the qualitative phase. After we got the data points from all the students that we sent out the survey to, we basically reach out to them further, and then we carried on an in-depth interview. It was not exactly a physical interview, but again it was a self-reported one where we gave them a questionnaire and asked these students to answer give provide answers to those questions, self-reported basically. And how did we choose these students from the survey? It was they were randomly chosen out of all the people we currently had. It was basically done through random sampling. So now talking about the limitations of this research. A survey could not be conducted on the total number of students as highlighted in the goals, like 2000 students. We couldn't do that. We only carried it at around 360 students so far. It's still a work on progress, and there are other limitations to this study. Especially, you might have guessed it based on the research methods that we employed. There might be some cases of sampling bias. Even though we tried to be as random as possible, within those sample, it might not necessarily highlight uh, the demographics makeup of the student population, which means that there might be certain changes based on your race or gender, which was not accounted for because the whole sample was randomly chosen for the second part of the survey. There might also be a case of response bias where people might not be willing to disclose truthfully, so there might be some errors in that. And again, this is self reporting, so those are the same errors that might occur in the data points. All right, so now let's talk about the findings of this research so far. In the qualitative, let me first talk about the quantitative phase and then let's go to the qualitative phase. The quantitative phase, we basically found out that 37% of those who were surveyed, they reported, say, stating that they had faced a lot of problems during the pandemic, especially regarding finances, because some of them struggled, which they didn't struggle before the pandemic and began struggling. And 62% of these responses also indicated that they had delayed seeking healthcare at least once due to the concerns about affordability. It basically, they said that before pandemic they might not have denied it, but now they are denying it because first the main reasons that most of them talked about was that firstly, lockdown. Everything was shut down, so it was very hard to traverse to a hospital, as well as most of their parents were against them going to the hospitals because they thought that they would risk themselves being exposed to COVID 19. So they delayed seeking healthcare, as well as like any kind of like mental health needs or something like that. Other points that we found out was that among those surveyed, 45% reported having a health insurance, while the remaining did not have any form of health coverage. Although most college requires students to have health insurance, most don't. So this was another findings that we found out. Now going on to the qualitative phase, this is mostly related to mental health based on what we found out. Students basically reported that there has been systematic barriers during the pandemic to for them to access healthcare, especially lack of awareness, fear of judgment, inadequate resources. Also, everything was online. College was held online, so they struggled finding like companionship, and therefore this led to mental health problems as well, or more particularly loneliness. Students also highlighted the role of the community-based initiatives that might have their college might have offered. This might include like engagement, virtual engagement, stuff like that, like connecting students, pairing them up. And what is the most surprising thing about all this was that uh, most of these students, around 66%, reported that the same problems that they faced during the pandemic time is still prevalent to this very day post pandemic. So they are still struggling to adjust to the college campus, uh, struggling with loneliness and stuff like that. Now, there's some more data points. One was 57% that was surveyed reported experiences significant decline in their mental health, which is obvious due to online as well as getting detached from the rest of the world. And 38% of respondents also indicated that they had used telehealth services during the pandemic, which is some positive sign. And but still within this 38%, 22% also reported that they only were able to use it like once or twice and not as often as it was needed or required because of issues with finances. Now coming to the qualitative phase again, mental health impact again. In interviews, which basically were again self-reporting, highlighted increased stress, isolation, and access challenges. We also found out that community support like virtual peer support group and wellness webinars extremely helped in elevating the mental health crisis that these students might have. Some also reported that those who are facing physical health problems like being diagnosed with COVID, being ill with COVID 19 or other such illnesses, these things were also elevated due to the virtual peer support groups that they had access to in their colleges. Now, what did we learn from all this? Firstly, policy change is a must. We found out that many students are struggling because they don't have access to proper healthcare or community based interventions, and therefore we have to work on this. Community engagement is also extremely crucial. This the data so far highlights that it plays an effective role in reducing the stigma of seeking help and expanding health access to the students. Even though it might not be health oriented in nature, just like talking to your peers, it helps in elevating that stress from the students and helps them better adjust to the college campus as well as elevating general health. Technology again is both a challenge and a solution. We noticed this in during the COVID 19 pandemic is that most of these technologies are not the very best because it's everything's online and there's added stress of being detached from the rest of the world. But this again can help in elevating the mental health and other such issues of the students, primarily through virtual peer support or maybe telehealth. Now, what are the recommendations? Policy recommendations, community-based strategies, and technological solutions. I already touched base upon this previously. Now, just briefly talking about it, we have to expand the Medicaid to include college students from low-income households, as well as provide resources to colleges for campus-based healthcare clinics or partnerships with local community health centers, as well as which basically means helping students find support groups around campus so that their overall health can be elevated. The other one is develop a community driven interventions that address specific health disparities as well as advocate for policy making around the system. Another is like basically expanding the reach of technology to reach a wide range of socioeconomic status. Now, key points mental health impact, already talked about it. Telehealth disparities is vital, but access gap exists. Digital equity programs do not bridge this gap as we hoped it would. There are financial barriers as well as other issues such as stigma and stuff like that. Community driven healthcare, support groups, and wellness programs have proven to elevate any kind of stresses that might exist on the students. Emergency planning, such as proactive emergency plans with clear communications, would also be essential for future readiness in such cases, especially if there's another pandemic or how to address the stresses that were inflicted upon the student population during the time of COVID. Now, what are the suggestions? Firstly, start by investing in mental health. We have to see a lot more investments in the field of mental health, especially in enhancing the services that are provided to the college students. The next is digital equity, which means ensuring that everyone has access to the required technologies to get equal telehealth access. Another is financial aid and insurance, which basically means that there should be some programs in which the college should cover some parts of the insurance cost so that it might help in reaching a wider range of socioeconomic status as well as helping a wide range of students. Next is community collaboration, which is extremely crucial, and it's the only way in through which such kind of stresses can be elevated amongst college students. Now, for the conclusion, which I already talked about, community driven healthcare is quite important for proper healthcare based intervention. Now, these for the references, and thanks a lot. Have a great day.